I'll just introduce myself. I'm Sharon Reynolds and I'm the Service Manager for Methodology at the Care Inspectorate. We've got a few different people with us today. So we have Anthony O'Malley. He's kind of working behind the scenes, looking after the slides and that. We also have Tracy Palmer. She's going to be doing some presenting for us. And we have Alison Tyson from our improvement team, who's also going to be doing some presenting as well. So a couple of different people. Do you want to move on the slide, Anthony, there? Okay, so just a little bit of housekeeping. We're aiming to run for an hour and a half and the webinar will be recorded. How long we run depends on how interactive people are, how many questions and that we get. But we're hoping that will be approximately our time. If you do have another device available, that's going to be really useful because we're going to be using some interactive AHA slides. So if you have a mobile phone or other device that you can use, that will be great. Don't worry if not, we'll tell you how else you can still engage with us on that when we get to it. Please use the chat. I see lots of you there are using the chat, so that's great. So you've all found that easily enough. So please do use that to ask questions, make comments, anything like that. A lot of questions and that we'll try and save for the end, but people may answer you. One of the people I mentioned a minute ago may answer you during the course of while we're talking. We have got mics and cameras disabled during the presentations, but obviously when people want to ask questions later, if you want to turn your mic and camera on, that's absolutely fine. We'll be giving you a link to a feedback form towards the end. Please do fill that in. So we're doing a fair bit of input around self-evaluation at the moment, and we need to know what's useful for you, what's helpful, what's not helpful, so we can see what other kind of support would be good for us to come up with as well. And also a recording of this will be made available afterwards as well. Thanks, Anthony. So what are we doing today? So an overview of self-evaluation in practice. So this is primarily aimed at people in adult services. So if you're here and you're from ELC or CYP, it may not be entirely relevant to you. Obviously, the principles of self-evaluation are applicable to everybody, but we have aimed this session specifically at adult services because those are the services we're working with in a test inspections over the summer, and this is more about kind of supporting them to prepare for that as well. So we're going to give people an overview, just a little bit around what self-evaluation is, what the core assurance is, getting that better understanding of what self-evaluation looks like and how you can actually implement that. So some practical support about how you implement that, and also sharing experiences of what other people are doing in their services as well. So next slide, please, Anthony. So this is our first AHA slide. Okay, we have a hand up. Is there somebody desperate to come in? Okay, I'm not hearing anyone. Okay, so with your devices, if you want to use the QR code, or there's also a link there to use, and I see some of you have found your way in, so that's great. If you are having technical trouble and you can't get into the slides, then please do use the chat so that you can still engage with us and give us your views. So we have about 90 people in at the moment. Like I say, there's a link there as well underneath the QR code. So if you're having trouble using the QR code or you don't have a phone camera, then you can use that link. So we've got less than half of the people that have managed to get in at the moment. That's increasing. Like I say, we'll give people a minute to find their way into the AHA slides. So we're getting all different answers at the moment, so that's quite interesting. So we've got some very confident people and confident people. A couple of people coming through in the chat. Like I say, if you're really struggling and you can't get in, please do use the chat. We'll still be looking at your answers and your comments and everything in there. Okay, so a couple of confidence and somewhat confidence there in the chat as well. So definitely seeming like somewhat confident is kind of leading that at the moment. Okay, just a few more people coming through. Okay. Okay, that's great. Thanks, everybody. So I think we're taking from that everybody's kind of falling to around the somewhat confident. So maybe has a little bit of knowledge. Some people are feeling a bit more confident than that, and a few people a bit less as well. But that's fine. So we're not here today to teach you everything about self-evaluation. You know, we have done a number of previous webinars which you can find online, and we also have other things that are available as well. So you know, we're hoping that this supports you in a more practical sense to kind of gain confidence in what you're doing. Next slide, please, Anthony. So we have a number of different resources available, and these go into quite a bit of detail around self-evaluation, what it is, how to do it, the kind of theory behind that. So we have, like I say, previous webinars that we've done, recordings from those. We also have toolkits for most adult sector types. I think vendor accommodation is the only one that we don't have a specific toolkit for at the moment. Those toolkits contain a range of different, hopefully helpful bits of information. So you have actual guidance in there. So that goes into the step-by-step how you undertake self-evaluation. Also links to some of the guidance that is existing out there in terms of the theory behind it. We also have some templates to help get you going to see what maybe it might look like when you're doing self-evaluation, some ideas of how you might structure that. So those toolkits, like I say, are there on our website. We also have our hub and the improvement support section. We have our quality frameworks within that, and also links to some of the webinars and toolkits. So I think Anthony's going to pop some links into the chat for you so you can see where those things are. And like I say, on our website as well, we have those specific toolkits and a specific area where you can go and get that information. So like I say, we're not going to keep going over that same stuff because we have gone into that before. This is more of a refresher about what self-evaluation is, but that more practical help for today. Next slide, please, Anthony. So we're going to start off again with our aha slides. So tell us what's good about your service. What is it that you think you do really well? What are you proud of? You know, what's interesting in terms of the things that you do and what you achieve. So again, using the QR code or the link that's just underneath the QR code. Again, if you're unable to use that, then please do just pop something in the chat. Great, that's people coming through very quickly. I love that one. Our staff are amazing. That's great. Lots of great information coming through there. Okay, just let people pop some more things in. Good teamwork, shared learning. Lots of things here about person-centered support to people. Meaningful engagement, promoting dependence. Lots of appreciation for the teams that you're working with and the staff. It's great. Your values and culture, yeah. Developed an excellent service user involvement group, great. Again, so that person-centeredness coming through. Again, having a great staff team. Really positive things here, supporting people to live at home for longer. I like that. So a curious line manager. That's a really interesting one. I like that. Competent staff team who actually care, always a bonus. Joint partnership working. So some of these things are really specific, but lots of really great information there about what are the good things in your service, and great to know, see how easy that's come to you. You know, we've got so many responses, got 8 pages of responses there already. So that's come to you, you know, really, really quickly and really easy, understanding what's great about what it is you do in your particular service. So I love that. So next page, please, Anthony. So that all came super easy. So what about this one? What could be improved in your service? So you've told us what's great, what's maybe less great. What areas are people currently working on, or that you know need to be developed a little bit? First one, communication. You know, that's always, yeah, some aspects of communication. And thanks to those of you that are putting in the chat as well. Like I say, if you can't join in with the slides, please do use the chat. More budget. I think that could be improved in everybody's services. Yeah. Recording. Yeah, that's often an issue, isn't it? The communication coming up a few times. Technology. It's good. Yep. Everybody's trying to utilize technology better, aren't they? Evidence and quality assurance. Great. That's why we're here. Sickness, transport, staff retention. Yeah, there's lots of great stuff in there. Yeah, and somebody's popped in there, always room for improvement. Exactly. Budgets again coming up. Staff retention involving families. Yeah, like someone's added meaningful training rather than just the required training, which sometimes has little bearing on the needs of the person supported. Yeah, very much so. Yeah, not just kind of off the shelf generic things that really matter to people. Great. And again, obviously lots of things coming through, so you know your services really well, and you know kind of what's working, what's not. Somebody's popped in their self-evaluations. Yeah, you're in the right place then if you want to improve those. Yeah, money, government. Yeah, I mean, unfortunately, we're not going to be able to help with that today. But yeah, you know, budgets and finances need to be improved for people. Staff retention coming up quite a lot as well. Capturing the good work that happens here, that's very difficult. I've seen a few webinars recently on how do people capture outcomes, you know, how do you evidence those outcomes that you're achieving, those really positive things. Using toolkits better from CI and SSSC, yep. Okay, great. So that's loads of stuff. So you've gone through, you've identified tons of stuff there, absolutely tons of stuff in terms of what's good and what can be improved. So next slide, Anthony. So this is about then tying those things together. So how do you know those things? How do you know that you're great in terms of, you know, you've got a great staff team? How do you know that? How are you measuring that? How are you finding that out? And how do you know that other things aren't working? So immediately there, feedback, really important, super important. People telling you observations, yep. Supervisions, team meetings. Listening to the people on the grounds, oh, totally. Great source of information is your staff. So we have things like questionnaires, spot checks, written evidence, feedback, satisfaction surveys, your exit surveys, I think it's there. So awards somebody's getting there, kindness in care awards. Gain lots of feedback, audits, one-to-ones, reviews, observations. And that was well-being calls with families. So yeah, tons of different ways that you're getting that information. What you see, yeah. So your observations, surveys and benchmarking. Perfect. Questionnaires, yeah. So all of these things here is how you're going about answering those first two questions, isn't it? So that's how you know how you're doing. And all of these things that you're talking about here are ways in which you're evaluating your own performance. That's your self-evaluation. You're going in, you're doing something which maybe your exit interviews when your staff leave, because maybe you need to understand that better, your surveys, your audits, all the things that tell you where you're at and what's going well and maybe what's not going so well. So all these things here that you're talking about just evidence to us, or you know what self-evaluation is. It's maybe called something different, but actually you're doing it. And this is one of the things that we really want to promote when we're talking to providers about self-evaluation, is that it's not this big scary new thing that's suddenly being introduced. It's things that you do already. It's not an additional burden that we're adding to you. It's things you already do or should do, and it's about putting maybe a bit of structure around that. It's not about introducing new things into it. So you already know how to make an evaluation of where you're at. You're already doing audits, you're already having the conversations, you know, you're observing practice, you're observing people, you're talking to people, all these things. That's your process of self-evaluation. So hopefully today we're going to show you how to put a little bit of structure around that, and also tell you how that links to the test that we're doing during the summertime as well. Next slide, please, Anthony. So what are the core assurances? Now, I'm hoping that most of you know the answer to this because you'll have seen them. They're in the framework. We've been talking about them for a few years now. Again, not new things necessarily. So these are things that as inspectors we used to call must-dos, because it was a thing, all the things that we must do on inspection. Very simplistic. And we changed the name of these a few years ago, because we started to think about how could we increase that transparency with providers and show providers what it is we look at, because that's one of the questions we get asked a lot. You know, what is it you want to see? What is it you're looking at on inspection? So we made it into almost like a list of different things that we look at. Now, depending on which service you actually come from, it might be slightly different. So as an example, care homes for adults and older people, they have meaningful connection within their core assurances, whereas care at home doesn't. So it can vary depending on the service type that you actually have. So just be aware of that. If we're talking about something that's not necessarily relevant to your service type, we have a lot of different service types on the call today. So our core assurances, they come from, we just pop back, sorry, Anthony. They come to us from a range of different areas. So they were initially based on the whole early indicators of harm. And that's something that you can go on and have a look at if you're more interested in that. But just kind of research that's told us, well, what is it that should be worrying to us? What are the things that we should be really concerned about? What are the things that contribute to people's safety and well-being? So we as regulators have that knowledge and that information, and we wanted to make sure that you guys did as well. So like I say, you can find these core assurances in the front of the different frameworks. The next one, Anthony. So why are we focusing on the core assurances for this self-evaluation test? There's a couple of different reasons. The main one being is it's something that we do anyway. So it's something that we expect to see in services and should be the real basics of your service. So it's not about kind of, all services are performing at different levels. Some are really well performing and, some services are struggling a little bit more. So this takes away some of that because everybody has to have the core assurances in place. So this applies across the board to everybody. We want to be able to kind of support that improvement and empower services in evaluating their own performance. And this, again, is that basic standard that we need to see across everyone. So everyone should already be doing this, even if they haven't been able to move on and do things which are maybe a little bit more complex or innovative. So it goes across the board. Everybody's familiar with it. Everybody knows their core assurances. Everybody knows the things that need to be in place to make their services work and support those really positive outcomes for the people using them. So they're already familiar to everybody. Everybody knows what they are. We expect to see them in every service. And actually, because some of them are quite process-based, they're quite easy to evidence. And this is the bit that's quite important for us. And we'll talk later about what will actually happen on your inspections and what they will look like. But we can quite easily measure the core assurance self-evaluations in terms of, does it reflect what our evaluations would be? Can we build a process that is trusted both from our perspective and also your own perspective? So we can validate those core assurances much easier than something that is, maybe based on other areas of the framework. So when we're taking this first step towards building that trust, then this seemed like a really good place to be. And when I talk about the trust, this comes from research and also our own previous experience with self-assessments where, sometimes people don't want to tell us things that they are maybe, needing improving in their service because they feel like there's going to be some kind of consequence or we're going to be punitive towards them. It's going to affect their grades, something around that. And we want to build that trust in terms of this isn't what that is. It's not about saying, oh, right, you've said that that's terrible, we're going to, grade you as such. It's about, well, actually, where your service is at, whether that's good, bad, or somewhere in the middle. You know that, and we can trust that that, and that in a really concrete way, and you can evidence that to us. And that if we came in, we would have the same evaluation as you're giving it yourself. So that's when I'm talking about the trust. So we can create quite a good baseline for self-evaluation from that. We can also, like I say, easily see where everybody's at. Next slide, please. So this is what you might have seen within some of the templates in the toolkits. So we do have a specific self-evaluation template for core assurances. You can see on that slide, it gives you an idea of the improvement plan and also the self-evaluation template itself. So we explained when we put the toolkits out that the template for self-evaluation looks slightly different because they're more concrete and more process driven than some other areas of the framework. And we felt that was reflected in the template that we'd come to. Now, of course, nobody's saying you have to use our templates. These are supportive documents for you to help point you in the right direction and give a little bit of help for those who want it. Lots of services, they have their own thing going on. They have maybe their own quality systems. That is absolutely fine. You don't have to use ours. All we expect is that there are certain things that are covered, say, within an improvement plan. Again, we don't need you to use our template, but we do need to make sure that it covers, who's doing what are the actions, what are you expecting to see? There's a time scale, that there's some kind of review built into that. So those are the kind of things that we would just expect. How you present that to us is then up to you, as long as it covers the right things. So that's a little bit about the core assurances, and Tracy's now going to come and talk to you about the self-evaluation process and just refresh with that and actually go through a worked example with you. Thanks, Tracy.
Thanks, Sharon. So my name's Tracy Palmer. I'm an inspector with the methodology team. And before this role, I was an inspector in the adults complaints team. So going back to when we first developed the quality frameworks, the primary purpose was always so that they would be used as a tool for self-evaluation. I'm sure that most of you will be familiar with the frameworks and the 3 self-evaluation questions, but as a refresher, I'll talk through these before we move on to the worked example using one of the core assurances. So the first question that we have is the one up on the slide. So question 1, how are we doing? So this is the key to knowing whether you're doing the right things in the right way, and whether, as a result, people are experiencing high quality, safe and compassionate care that meets their needs, rights and choices. So the core assurances self-evaluation tool has prompts under each core assurance to help you set your parameters and identify the evidence and the feedback that you're going to gather. So as Sharon said, they're a bit more process driven, so it's a bit easier for us to put those prompts in for you, because it's the same things we would be expecting to see in every service. Those prompts are also on the core assurance checklist, which you can find in the quality frameworks too. Whenever you're doing this, you should also be looking at the health and social care standards and good practice guidance as benchmarks, and that will help you to understand how you're doing, what's going well in your service, and where improvements need to be made. So as you all said already in the AHA slides, the evaluation part of your service, so the how are you doing bit, should be made in collaboration with the people who are using your service, families, friends and carers of the people who use your service, the staff that work in the service, so staff at all different grades and all different roles, external professionals that have contact with your service, and also other stakeholders. So as you all said again, it can be done in loads of different ways. So it could be talking to people, it could be at service events, focus groups that you have, it could be through meetings, whether it be with relatives, service users or staff, and you might issue questionnaires or online surveys. That's just some of the ways that you might do that. You need to think about the information that you want to get from people, as that will influence the questions that you ask. So there are some example questionnaires in our toolkits, but they are just examples. You would need to think about how you wanted to use those and tailor the questions to gain the feedback that you're looking for. Next slide, please, Anthony. Okay, so question 2, how do we know? So for this question, you need to think about how you've arrived at your answer to question 1, how are we doing? So whenever you're answering question 2, you need to use evaluative statements based on that evidence that you've gathered. It's important that it is based on robust evidence, and it can't just be assumptions or how you think you're doing. You have to be able to evidence what it is that you're saying. The evidence that you gather, along with the views of the people experiencing care, their families and their carers, will help you do that and evaluate how you're doing. Next slide, Anthony. So question 3, so what are we going to do now? So understanding how well your service is performing should help you to see what's working well and what needs to be improved. So by answering each of the questions, the previous 2 questions, you will have identified where your service is doing well and where you need to make improvements to support better outcomes for people. And then that information will help you to write your improvement plan. So you'll be able to see the key areas where you need to make improvements, and then in consultation with people using your service, agree on a plan to address those priority areas. So the plan should be reviewed regularly, and you should make sure that that information is accessible so that you can share the plan with the people who use your service, stakeholders and staff. Their participation in the process is essential. So once the plans have been actioned and achieved, the tool can be repeated to see if the evaluations have moved. So you can use that to assess how much improvement you've managed to make within the service. And as Sharon was talking about, self-evaluation should just be part of your normal participation and quality assurance work within your service. The core assurances are things that you will already be looking at and have things in place for checking. Next slide, please, Anthony. Okay, so we're now going to work through a worked example together for protection, which is one of the core assurances, and we're going to use the AHA slides to do this, just like we did before. So as I mentioned, the prompts for the are on the core assurance checklist for the and on the self-evaluation tool. So for protection, these are that there is an adult support and protection policy and procedure that evidences how people are kept safe. Staff are trained in adult support and protection and are confident in knowing when and how to make referrals, including notifying the care inspectorate. So that's talking about those allegation abuse notifications that you would submit. And where required, there's evidence that appropriate adult protection referrals have been made and that these have been followed up. So that's the areas that we're going to look at within this part of it. So next slide, please. Okay, so just over to you. So we'd like you to share your thoughts and your ideas on this slide. So if you think about this, and just start putting in your ideas as I'm talking. So if you think about it as your own service, how would you know how you were doing in relation to protection? So what evidence do you have available? How would you get feedback? Who would you involve? What already works in your service that helps you to self-evaluate, and how could you use that for protection? Oh, good, we're getting lots of answers. And what methods have you already got in place for feedback? And how do you involve people generally? Like, what are the things that you do? Okay, so we've got lots of training, absolutely. Looking back at notifications, yep. Audits of referrals, absolutely. Training, review policy, absolutely. Okay, what else have we got? Complaints, checking policies are up to date, checking that staff have completed training. So these are getting the gist of this. This is all the things that we would be expecting that you would look at. Feedback from the Health and Social Care Partnership, yep, that would be a good source of evidence for you. Training, discuss with teams, yep, absolutely, keep it on the agenda. The number of ones AP1 submitted, so that would give you a good idea of how well you're recognising those concerns and reporting them. Having it as a standard agenda item. Notifications, having safeguarding champions and having regular meetings, that would be good practice to do that. Audit and paperwork. So you get, these are all really good suggestions. So you get the idea of, if this is what you were going to look at in terms of protection, these are all the sources of evidence that would be available to you in terms of getting that feedback and your existing quality assurance, the things that you're already doing. So for this, you can see how this would fit within what you already do without having to add much more to it. Okay, next slide, please. Anthony. Okay, so for this worked example, we've answered question 2, the how do we know question. So this is what we've found. So we've looked at the adult support and protection policy in a mixed focus group with people experiencing care, their families, staff, and we've included the linked social worker for the service. Within that, we've looked at staff training records, so lots of people said that, and we've got some feedback from staff about the training that they've completed, and we've done an audit of our accident and incident records for the last 3 months, looking, including the protection referrals. So that's about looking for patterns, looking to make sure things have been reported, all the things that you have said in the previous slide. Next slide, please. Okay, so now we need to think about what we've learned from answering those previous 2 questions. So this is the template that's on that self-evaluation tool that Sharon showed you earlier. So this is the same format. These are the same questions that are under each core assurance on that forum. So how can we evidence that we meet this core assurance? So we've got adult support protection policy is up to date and provides clear guidance for staff. So we've looked at that policy and we're quite happy that it's doing what it needs to do. People and their families told us that staff were good at recognising concerns, so that helped them to feel safe. So that's really important. Accident incident reports and protection referrals were sufficiently detailed and completed within required timescales. So that audit of those records has told us that information. Any additional actions to be taken. So areas for improvement we've identified from that. So for the purposes of this worked example, we've got 2 medication incidents that should have been reported as protection concerns, but were missed by staff. So it could easily happen in any service. We've not yet had an update for 3 protection referrals that were submitted, and we've got 5 staff who were overdue their refresher protection training. So again, these are kind of typical things that you could find anywhere. So next slide, please. So it's back to you again. So if you were thinking about this as your own service, and this was your evaluation of that protection core assurance, what are the things that you would do? So just start to put in your ideas. So thinking about the actions that you would take and what you would include in the improvement plan that you're going to develop. So just to give you a wee reminder while you're doing that, we've got the 2 medication incidents that have not been identified as protection concerns. We've got 3 adult support protection referrals with no updates, and we've got 5 staff who still need to do that training. Okay, so we've got training updates, enroll staff on training. Right, okay, so people are getting the training part of it. For the training, we would need to think about that in terms of why that was out of date, because there's lots of reasons why that could have been. Might be that it was planned and it was cancelled. It might be that we've not got a good system for recognising when the updates are due. It could be that the training's online and the staff are having some difficulty accessing it. So we've got monitor training records. So think if we got a wee bit more down there. Staff meetings, okay, feedback to people in charge of medication incidents. So we definitely need to think about that medication one. Maybe is anybody got any other suggestion? Medication audit, okay. Action tracker, yep, so for follow-up on those outstanding referrals. Training updates in relation to medication, So you're getting the gist of it, you know, in terms of how we might improve that and the things that we might move on to that improvement plan. Audit more frequently. Yeah, okay, they're all really good suggestions, really good suggestions. So Anthony, move on to the next slide for me. That's great. So we've now looked at what we could do to address it. So now we've got our improvement plan for question 3. What are we going to do now? So for this one, what we've said is that we're going to look at the medication policy and procedures, so people picked up on that, and ensure that these direct staff to make protection referrals when required. So there's maybe just a wee gap in our processes around medication, and that's why those have been missed. We're going to add some follow-up dates to the management diary 4 weeks after a referral is submitted, just so that we get those updates and that we're tracking that, because things can, you know, services are busy, things can get missed. And for this one, we've made the assumption that the training was arranged and it was cancelled. So we're saying that we're going to allocate protected time so that that training can be completed. So pretty straightforward things to fix it. You know, we're just looking at what's the problem, what's the solution. The important part in this, as Sharon said, you don't have to use our templates, you don't have to use our improvement plan. But what you do need to do is make sure that your improvement plan follows the SMART principles. So you'll see in this example, we've been specific and detailing the actions. So they're clearly saying what needs to be done and who's responsible for doing it. They're measurable to allow you to track your progress. So it needs to be something that you have a benchmark that you can check to see how you're doing. They can be completed within the resources that we've got available, so they're achievable and they're realistic. And we've also included some time frames for completion. So we're saying when it is that we're going to have those things done. Now, things can change and you might need to review those time frames, but having that in place is a good, in terms of measuring it, that's something that's important. So thank you everybody for getting involved. That was really good. Your suggestions were good, and I hope that has helped you to see that you are already doing a lot of these things that you might think you don't know about self-evaluation, but it is already part of the things that you're doing every day. And having a go at answering those questions and using those 3 questions hopefully has shown you how you might use that core assurance self-evaluation in your own services. So if you've got any questions, you can put them in the chat just now, or there's a question and answer session at the end, so you can put them in there and we'll pick them up and respond to them then. I'm now going to hand over to Alison, who is in our improvement team, and she's going to share some feedback from providers who have used self-evaluation in their services to make improvements. Thanks very much. Over to you, Alison.
Hi there. Thanks, Tracy, for that. So now that we've been through the process of self-evaluation and also the Care Inspectorate's reasons for using it, we thought it would be a really good idea for you to hear about other people's experiences as they've been using it, and how people that are experiencing care themselves have also benefited from self-evaluation. So firstly, we're going to show you a video which is an interview with Eileen, who's the manager of a care home. And she's going to tell us about how she benefited from self-evaluation and how she's used it in her home.
Yeah. And when did you first think about introducing self-evaluation into the service?
I mean, probably because those I've had, I've sort of been involved with the Care Inspectorate quite a lot, sitting at feedbacks for years, all with managers, going to all the conferences, always looking at all the Care Inspectorate documentation and how to use it. Self-evaluation, probably it came out, I remember the document, and I'm thinking about 2017, 18, and it was self-assessment. We had the QAF, the Quality Assessment Framework. I remember as a manager, you had to complete all that and send it in. And if I can remember rightly, this kind of replaced it, and it was like, you know, self-evaluation, looking where you are in your service, what's good and what can you improve on. Yeah. So at that time, yeah, I went to a home that had lower grades and needed quite a bit of work in 2017, and I used that basically as a tool, was to look at the service and look at what actually was going on, what was really good about it. I've always focused on all the positives, because there are always positives everywhere, and then look at what is it we need to change. So, and it's really taking the staff with you. I think I'm only a facilitator as a manager. As I say, I know that it's a key person in the jigsaw, but basically it's your staff and the culture that gives you results and care. Yeah. And I'm basically facilitating that and supporting. So I would use it really to get your team on board as the document, to get them to look at what are they doing that's really good, and what are they doing that they think they could do better, or they need support and training development to do that. Yeah. So that's what I would use that for.
So how have you managed to get staff on board to use self-evaluation? How have you kept them motivated?
I think, I mean, I've done over the years a lot of leadership courses, and again, I think it's always about looking at your service. Probably I've been using self-evaluation. I've been in this home just about a year, probably more recently, because at the beginning you're kind of looking at what's good, not changing anything to start with, just taking it all in, looking at people's skills. Always, have you got the right people doing the right thing, and also saying the right job, which I know is key. And then you're looking at what are the strengths. Invest your time in getting to know the staff and valuing them, and making sure they are in the right roles. And then you're looking at gradually sort of introducing the standards, explaining to them what are the health and social care standards, what are the principles. I've got them up on the wall, because people go panic, think, don't know what they are. So I think the framework really fits in with compassion, being included, dignity. It's basically what they're doing every day. But when you ask them about all the big words about, you know, the standards and all this, and even senior staff will go, oh, you know, all that kind of stuff, they kind of panic. But I think probably for me, probably being a very people's person, I've broken down all my meetings to heads of department, and probably or one member of staff from every department. So every meeting I have, usually, unless it's a trained staff meeting, the monthly meeting is somebody from every area. So there's a domestic, my maintenance man, my chef, carer, and a nurse. So ideally, everybody's in everything all the time. So it's not, in this home, I'd say hopefully sustains as a good home, because it's a team work. It's not, that's her job and that's mine. If I walk around and I see something on the floor and you pick up in the bin, it's not like I'm not domestic. So it's valuing the people, and I think staff feel really valued, that as a manager you want to know exactly what do they think is really good in the home, and what do they think we can improve on, and what resources and training do they need for me to help them do their job. But to me, probably the question I probably digress a bit is, it should be fun. You should be really love your work, be motivated, want to come in, and as I say, if work is fun and you're happy and you're a role model, everybody replicates. So I think it's definitely about, you want to be here and you're passionate what you do and you enjoy it. If you don't enjoy it, I think you should just look elsewhere. So
so it sounds like you involve your staff a lot in getting their ideas about what they do well and what they could improve. So you're obviously having that regular communication with all your staff across the board, whether it be care staff or maintenance staff or domestic staff. So that's really involving everybody, isn't it? And that's the way self-evaluation should work, isn't it? That everybody's part of it to make that improvement and to find out how good you are.
Definitely, and I think it's one size fits all. I mean, for here, like, again, it's been COVID in 3 years, and as you know, in a lot of homes, training had fell away behind. A lot of things had to be reinvented again, started up. And even what staff loved, then we did get our training platform where they've all got the online training. And it's funny, staff really embraced that, which I was quite amazed, because they said sometimes they felt if they were in a training and they felt a wee bit silly and they didn't know the answer, they felt intimidated. So I thought people would run a mile with the online training, because so I think it's never to judge. What do you think your staff would like, you know? So you would think they just embraced it. And you know, I've got a domestic who's on like 20-odd course. She's doing everything that's not even anything to do with her, but she just loves it and she likes to go in and do it. But so it is probably, I don't think there's, I think I would do away with a prescriptive way to run a service. So it's not like have surveys, have meetings, I know there's a lot in the framework about all your evidence, but again, it's looking at all the source of evidence to say, though, but what suits this home, what works? Like, for example, most services, and I've done it in large corporates and different things, have flash meetings where you all heads of department meet at 11 o'clock. Some corporates, it's got to be a certain time, some corporates not. I've done it here. It wasn't feasible. It's just a small home. I couldn't take all people off the floor at 11 o'clock. I'm very not hands-on physically doing care work, but I do a walkabout. So I do a walkabout audits, replaced it, and then I do a handover report that goes under my door. So in some homes, absolutely, it works. Here, I thought, you know, I'm not taking people away at that time. It's not going to. So I think you have to look at, there's different ways of doing everything. And you don't have to be prescriptive and do certain audits all the time. You maybe look at what is the bit that I could improve, and maybe say down the experience I thought was maybe my focus, that I thought that could be better. And I feel it's totally transformed, because nearly all my observation audits use the framework. A lot of them have been nutrition, because I thought that's a bit, and now I think, oh wow, it's getting there. And so I do think it shouldn't be prescriptive. You should self-assess what is the bit that's not good. Don't do them all the time, every month, when you know that area is fantastic, that area is always. So focus on the bit that's not good and spend less time on the bits that you think are really good. Why just have this gold standard audit schedule? So here, and this company is very good, we can tweak it to what we see is not as good, and things that are good, then I'm not going to audit that every 3 months or something, 4 months, 5 months, 6 months. So
so adapt it to what you what suits your service. And you were saying before, when we were talking about, you've been doing some work with staff about them doing the observations of practice and looking at maybe the dining room experience. So you're even involving staff in doing that element of self-evaluation. So that's really good. And then I would imagine that helps them to understand what self-evaluation is about and to see the difference that it can make.
Absolutely. I mean, an example would be my housekeeper who worked in Millport over like 129 residential outdoor centre. Who'd never worked in a care home ever, but came in, and she's probably been here nearly as long as me, maybe just under the year, but came in totally new, never done it. It was great, total fresh eye. Attention to detail. She has the toilet paper, a wee V in the toilet, so very into attention to detail. But this was brand new. She's embracing everything. She's now doing my infection control audit. She's doing my King's Fund audit. She's given me a toilet seat audit as to what they are. We've now ordered like nice grey, this dark grey kind of lamp hammerite paint to do. Her handrails are white because our toilet seats were blue, but somebody had put bleach over it and they were like marble effect, so they were replaced. So for somebody that has never worked in the sector, but basically amazing how she's using my framework. And I said, you take the environment component because you've been doing that all year, and now there's the framework. And I told her like a section. I'll open the section for it and say it's 4.1, whatever it is. Just read what is a really good home, and then look for 20 minutes on that observation as to, are we meeting that? What is good and what could we develop? And she's running with it. So I think it's really breaking it down to a wee bite-sized chunk as to,
yeah,
this is what looks like a good home. Is this what we are doing? We might be doing something that we think is not captured, but is there something you say, oh, I do think we could do that better? Because, and it's subjective. We're all totally different and we all read it. I mean, I've opened the standard. I'm not wonderful that I use it all the time, doing everything. But every time I use it, sit down and audit, I always find something that I could improve on, and good stuff. So no matter how many times I use it, you open it up, and I think it's nice, short and sweet, robust. Just read it, see what evidence the care inspector have advised you could look at, and come up with an action. And basically, I think that feeds into what we've improved is a huge amount of small things that I think has made the service go into that wow thing that you can focus on. Sort of, you're not having critical things, you're focusing on the attention to detail that could be a critical thing if you don't capture it.
So that's looking at audits and looking at observation tools, looking at things like best practice, looking at the sort of standards as well, that bringing all that into doing your evaluation and your service.
That's great, thank you, Anthony. So I hope that you found hearing Eileen's experience of using the quality framework helpful for making it more manageable for yourselves when you're starting to use it. So now I'm going to share some stories from other services that the Care Inspectorate Improvement Team has been working with over the last 6 months. And as part of this improvement work, we've been encouraging them to use self-evaluation to identify an area for improvement within their own setting. And for some of them, their starting point was their most recent inspection. And for others, they've used other different types of assessment tools and good practice documents as well. So if you can have the next slide, please, Anthony. So the first experience we've got is James's story. So after we had done our initial training, the management and staff of the home that James is living in had learned to reflect on how well they were doing. So they spoke to staff and relatives and the people who lived there. They reviewed their care plans and the information that they provided and observed how staff were using plans to provide meaningful activity, and decided that this was an area that they needed to work on. They asked their activities coordinator and other staff members to review and update the monthly care plans so that they had a more specific person-centred focus. And they also consulted with staff on how they were documenting all new activities, and they worked on the questions that they asked families and residents so that they had the information they needed to provide activities which mattered to each person. During this time, they spoke to James and his family, and this helped them to realise just how important gardening was for James. It turned out that he'd been particularly talented as a gardener and had won prizes at garden shows. So he agreed to take on the role of organising and coordinating a spring flower project for the whole home. And this involved him in helping and teaching other residents how to plant and nurture the spring flowers in the greenhouses. So by Easter, the plants were all ready to flower and able to be transferred into and throughout the home so that everybody could enjoy them. So the manager and the activities coordinator in that home now have a meaningful activities improvement plan in place, which will support the home to improve the experience of all residents at the right pace for them. And at the start of the project, the team thought that this would all take about 3 months, and they've now realised that 6 to 8 months feels more achievable. And they've also learned that by starting small, the residents are starting to have much more one-to-one activities and many more conversations with each other and with staff than before. Can we have the next slide as well, please? One of the other homes in our project as well looked at improving the environment for the people living there. The manager had realised that the environment needed to change so that they could support people with dementia better than they were. She'd confirmed this using a King's Fund audit tool and had created an improvement plan based on this. So changes to the environment included the creation of a more welcoming, snug and homely area, as well as changes to decor and flooring. And at the start of this, she'd thought that their focus would be on changes to the actual environment. And as time went on, she realised that to make really effective changes, she needed to involve the people who lived and worked there more. And as a result, the people living there and their families are now at the heart of making decisions and choices about how they use their home. They'd learned that self-evaluation isn't a one-off, and after making these changes, they reviewed the impact and reflected on outcomes for the people living there. So they started another round of consultation using surveys and meetings and listening to what people thought about the changes. They also took time to observe what was happening, and they found that people were very happy with how the home now looked and were now ready to make changes to what happened in their home, and were confident about making suggestions. And one of these was to invite children from the local nursery for a visit. And this was an experience that everybody enjoyed and is now happening regularly. Can we have the next one, please? And sometimes other events can lead to settings changing the focus of their self-evaluation, and that's okay. Another home in the group, the management team had initially thought that they needed to improve palliative care. But then there was a series of events that made them change the focus of what they were going to do. And these included their care inspector inspection, changes to management and staffing, and the big change that happened was Storm Babette, which had led to flooding in the local area. And all of these things combined helped them to change their focus to look at how they were engaging with the local community. They realised that as a result of COVID, the home had lost many of its connections within the community, and as a result, some of the people living there had become quite isolated. They decided to hold a coffee morning for their community, which successfully raised money to support local people who'd been affected by flooding. Feedback from people living in the home, their families and the community showed that the benefits were much more than the financial ones, and that people had really enjoyed meeting up with old friends and making new friends in the community. They had recently appointed a new activities coordinator, and she was very keen to build on the success of the coffee morning that they'd held and to continue building links within the community. And before long, they had developed links with local schools, nurseries and churches, and not only saw an increase in the number of people visiting the home, there was also an increase in the number of people who lived there going out to different places. And that included a lady who hadn't left the home since before COVID, and she's now out going down the street to the local coffee shop for her morning coffee. As a result of greater involvement in decision making by people living in their home and their own observations and conversations with relatives, They're now providing a variety of activities based on the interests and needs of the people who live there. Staff feel much happier and able to focus on meeting the needs of the people they're caring for, and there's now a real buzz in the home. Relatives are delighted by the changes, and at their most recent Care Inspectorate inspection, they found that not only had their grades improved, the requirement about supporting people to participate fully as a citizen in their local community in the way that they want was met. And I think I'm now going to hand you back to Sharon, who's going to explain what's going to happen next.
Thanks, Alison. So I hope that was useful for people hearing a little bit about you know, the impact that self-evaluation can have on outcomes for people using your service. The improvement team have been trying to gather some of these stories. The ones Alison was talking about there are from a recent workshop that had been held, an improvement workshop that took place over quite some time. It was a very specific piece of work. But if you have improvement stories that you want to share with us, you know, please drop us an email. And if there's positive things around self-evaluation that you've done that you'd like to share and promote good practice, then we'd love to hear from you as well. So just to kind of pull all those things together, this is a little visual kind of aid that we pulled together, and some of you might have seen this previously when we were testing it out with people. So this was just about demystifying some of that self-evaluation. You know, we keep saying this isn't something additional that we are expecting you to do. This should be part of what is happening in your service already, but maybe it's not always that easy to see that this is what you're actually doing. So at the top there, we have identify your focus. And that's just about recognizing what it is you want to do. And that might be because you've had some very specific feedback, or you may have had requirements, you may have identified something through your quality assurance processes. There's a huge amount of different ways that something could come to your attention, and you think, well, actually, we maybe need to do something about that. And it doesn't really matter how that comes to you, you know, just as long as it's arrived. Gathering your information and evidence, this is where things like your audits and your quality assurance activities all come into play. So that's how you gather that evidence to support your evaluation, whether that's, you know, maybe your requirement, like Alison was saying, was around meaningful engagement. So maybe you're going to go and ask people about that. You get some information in terms of people's personal plans and looking at what people are involved in and how you're getting information on what makes a difference to them, who are the important people in their lives, all that kind of stuff. And that might be about the conversations, it might be about the personal plans, it might be some other quality assurance thing you have, like feedback surveys. You know, do relatives feel like they're involved in the service? Do they feel like they can get good information on their loved one when they're asking? So once you've gathered all that information, you pull it all together and you make your assessment. You know, how are you doing? So that's when you're going to know, okay, this seems good. It seems like we're in a good place here. Is there room for improvement? You know, what kind of things are we looking at to be able to make that judgment? And that's evidencing your assessment. What kind of things contributed to your assessment? How do you know? How do you know that you're performing to a standard that you need to be? And that might be that you have looked at the frameworks and there's some illustrations around that, and you think, yes, actually, you know, we're reflecting in what a very good looks like. Or you might think, well, we're actually maybe towards the other end of that. Maybe there's some good practice documents. Maybe you're looking at something in terms of legislation or some other information. Again, there's a variety of things that could come into play there, just depending on what your focus of your self-evaluation is. So that's your how do you know. And then what are you going to do now? So because you've done all those things, you've gone through that process, it will be really evident to you by this point of what you need to improve. Or not. Maybe everything's great and you don't need to improve anything at all, and that's great. But quite likely there's, you know, always things that can be improved. So it may be that there's something that is additional that you could do to make things even better. So then you're just going to make a plan for that. And again, this is just a natural process that you go through when you're doing everything. You're going to think about who's going to be involved, how are we going to do it, when are we going to do it. So you're going to develop your improvement plan, your service development plan, your action plan. Lots of people call it different things. And then once you've done that, you're going to kind of go back and say, well, did that work? So you're assessing your impact. The so what question. So did it make a difference? Did it not? What have we done? How do we know? So it might be that you're going back and asking people the same question again and hoping that they're going to give you a more positive response now. You know, when you make that evaluation, it's going to be, you know, a lot more positive. So it's that cycle that just keeps going. When you've assessed your impact, you might be like, okay, cool, fine. There's nothing more we need to do with that. And like Eileen was saying in the video, you know, if you know you're doing well in certain areas, but you know you have some real areas where you need to concentrate your efforts, then focus on those, put your effort into that, and keep going with that till you're getting somewhere. You might have to then start again and go back to identifying your focus. You might have completed something, so you can kind of just put that to one side and say, right, okay, our attention needs to go towards something else now and move on to the next item in terms of your self-evaluation. Eileen was also quite clear that, you know, don't take on everything, don't take on the world there. The framework is huge. You know, what you do in your services is huge. Tackle one small bit at a time, because it will be much easier to see where you're making a difference and if what you're doing is working. So just take, you know, we've broken it down sometimes into the key areas within the toolkits. So it's, you know, the quality indicators themselves still quite big, key areas a lot smaller, a lot more focused, a lot easier to maybe get a good impression of where you're actually at. So break it down, take it one step at a time. But again, don't be put off by the language that's used or thinking that there's something is additional or different to what you already do. Like I say, it's just putting some structure around it. Okay, next slide, please, Anthony. So what's going to happen during this test phase? So we've told people that between July and September, we're going to be doing this test of self-evaluation. So when we're on inspections during those timeframes, we're going to ask to look at people's improvement plans. So we're already encouraging you to take part in self-evaluation and to complete self-evaluations in whatever format that looks like. We've asked people specifically now to complete a core assurances self-evaluation. Obviously, it's not compulsory. We've asked you to participate in this. You know, we do sort of expect that services are doing this in their own way already, but we now want to kind of put some more structure towards it. We're not asking you to submit that to us, but we will want to look at it on inspection. And that's what the message we've been giving for the past couple of years in terms of improvement planning. We're not asking you to submit anything, but we do want to see improvement plans, service development plans on inspection. Next slide, please, Anthony. So your inspection shouldn't look too much different. So as I mentioned earlier, our inspectors look at the core assurances on every single inspection apart from follow-ups. They don't look at them when they're doing a follow-up inspection. So they're always evaluating your core assurances, and they will continue to do that as normal. So they will make their evaluation. They're then going to validate your self-evaluation with the evaluation that they've done. So they will have come to a conclusion about where you are with all the different core assurances, whether, yeah, it's great, there's no problems, or whether there's some concerns around a particular core assurance. They will have made that decision already in terms of what they think. What they're going to then look at is in your improvement plans, have you identified the same issues or the same concerns? So if they're seeing maybe an issue with, let's go with protection like Tracy was talking about, if they thought, oh, you know what, actually there are a few outstanding protection referrals that haven't been followed up, and you know some of the trainings are a bit out of date there. Hopefully you've got that in your improvement plan already because you've already done your self-evaluation, you know where you're at, your quality assurance mechanisms are all working as they should be. And that's great because, you know, obviously, other than us saying, great, it's all working as it should be, we'll have nothing to say. If not, we may want to, you know, engage further and look at your self-evaluation in more detail as to, well, maybe where did it go wrong? How come you didn't notice that this wasn't quite as it should be? So people will have those conversations. We are not putting anything in reports in terms of like an assessment under a key question or part of your grading or anything like that. There will be some standardized sentences that we use within the key messages. So the bit that's right in the front, the kind of bullet point bit. So we will say something in there along the lines of, yes, the service had been involved in self-evaluation, you know, they were able to recognise where they were at, that kind of thing. It'll be very short and sweet. The conversation will be had on inspection in terms of, okay, I think you need to maybe go back and look at your self-evaluation again. I don't think you're quite getting it, or maybe the right activities aren't happening in order to support a good self-evaluation to get to the same kind of evaluation of your core assurances that the inspector got to. You should ideally be coming out with the same strengths and areas for improvement. And if not, then something has gone slightly sort of, you know, askew. Like I say, we're not grading it. This is just about us finding out where we're at, are we in that kind of trust process that I was speaking about earlier. Can people give good self-evaluations? Do they need more support in terms of what a self-evaluation is and how it should be undertaken? Or is, you know, can we move on to the next step in this journey? We want to get to a position where we're able to use self-evaluation, you know, as part of one of our scrutiny activities. So whether that's, you know, people are able to submit it and, you know, it takes place as part of one of our scrutiny activities. Maybe we don't need to come out. Maybe there's a self-evaluation that informs our risk of services. Maybe if there's people are struggling in a certain area, for example, you know, tissue viability or nutrition, maybe we can support people improving through self-evaluation. So there's lots of different ways where self-evaluation could be useful in the future, but we're not kind of at that point yet. So we need to go through this process to get us there. So in terms of the feel and the experience of the inspection, it shouldn't be any different. You might have some more conversations that are specifically around self-evaluation with your inspector, but overall that experience should be as it always has been. Yeah, thanks. So just to kind of sum all that up, again, that very initial purpose of our frameworks is being designed to support self-evaluation. I know a lot of you are already using it like that, and this has been the kind of journey of us providing you with tools, providing you with support, so that we can get to that point where we're using self-evaluation as part of our scrutiny actions. Obviously adopting that phased approach just to help people get to grips with what it is and how to use it before we kind of move any further. Obviously anybody taking part in that test, and it's not a volunteer thing, it would just be people that have their inspection at that point are involved in it. People get the opportunity to have feedback. It's not saying anything about your service or your management of your service if you're involved in that inspection. It just happens to be that we're just taking all the inspections that happen at that point in time and using it regardless of the service type or who it is. So, you know, there's no criteria for involvement or not being involved. And hopefully you'll find it really supportive, you know, see it as a plus point because you're going to get some one-to-one feedback on your self-evaluation and how you're doing and whether that's working for your service or not. Thanks, Anthony. So questions. So like I say, feel free to either put hands up or put questions in the chat and we will try and answer them for you. So I know we've had a couple of questions already. Going back to them, so I think we've had somebody asking about how often should self-evaluation be submitted. We are not saying anything in terms of a time frame. So we're not asking you to submit your self-evaluation to us at this point in time. So currently there's, the old self-assessment isn't, I don't know what you call it. It's not available on the website. There's no,
house went down
there's no way to submit that self-assessment. We're not asking you to submit that self-assessment. What we are doing is, obviously, we're on this journey, as we keep calling it, of promoting self-evaluation, and it might be in the future that we ask you to submit some form of self-evaluation like we did in the past with self-assessment, but we are not at that point yet, and we'll engage with you, as we keep saying, we'll have conversations as and when we move towards and if we move towards that being a decision that's taken. In terms of how often you should do self-evaluation, that's slightly different, because that's going to be about whatever your service needs. And I think, Eileen said that as well. Different things are going to need different inputs. So it might be that you have an area that you're particularly working on, and you're going to self-evaluate it fairly often initially until you've reached the place where you want to reach with it. Whereas other things, you're like, it's ticking away nicely in the back. I don't need to pay too much attention to it, and it can just go on whatever my regular schedule of quality assurance activities is. So we're not telling you anything in terms of how often you should do it. That needs to be up to you and what your service needs and what works for you. So we had another question there. Are we going to have access to self-evaluation webinar? Yes, Anthony's added that. The next one will be the same. So the next webinar on the 9th of May, it is the same webinar. Yes. Would it be good practice to submit it though if we have done it? We have no mechanism for submitting it at the moment. So there is no way to submit a self-evaluation to us. So that's not possible. You can have conversations with your inspector about self-evaluation, but they won't receive it on your behalf and do anything with it, if that makes sense. So the services that are inspected during the July to September test phase will get specific feedback on the self-evaluation process they are using. Yes, they will. The inspector will look at that process. Like I say, they'll be making a judgment about whether it fits with their own evaluation, whether the two line up, and they'll get specific feedback on what they're doing. Should we be reviewing the self-evaluation and actions monthly and then keeping them in case of inspection? You should be reviewing it as often as you need to review it, depending on what it is. Again, because an inspector is going to be doing their own evaluation of the core assurances, they will be able to see exactly where you are at that point in time, and your improvement plan should reflect that. So it might be that, last year you identified that there was a problem with something, maybe, your medication audits, but actually in the meantime you fix that. So it's not necessarily a live thing on your improvement plan anymore. Well, that's fine, because the inspector's then going to go in, look at your audits and say there's nothing wrong with it because you already fixed it. We've not had an inspection for 5 years. With the timescales for the trial, I take it would be unlikely, but prior to implementation of the trial. Depending on your service type, I'm guessing maybe a support service. We don't know whether you're getting an inspection or whether you're not, to be honest. It's dependent on the priorities of inspections. So I would say, make no assumptions in terms of whether you're getting one before that period, after that period. I wouldn't make any assumptions. What happens after the test phase? The short answer is we don't know, because it depends on what the test phase shows us. So in September, once we've done all the testing, we'll gather all that information and look at what that tells us, essentially. So we've proposed several things in terms of what we might like the future to look like, and I've mentioned those earlier in terms of supporting with people with specific focus pieces of work. And we already have 2 self-evaluations out that do that already. So one on restrictive practices for children and young people service. And we also have the meaningful connection ones from the Ansel group. So we have some things like that already, and we think that that's a really positive way forward. We also want to be able to use it, like I say, as an activity for our kind of scrutiny intervention. So maybe we can use it instead of kind of paying, you know, an actual visit to people. We don't know, because we don't know what this information is going to show us. What we do know is that self-assessment wasn't working for us. It didn't give us true enough information about the services that we were going to. So we may read a self-assessment historically and then go and turn up and it would be a completely different service that we were faced with. So again, that trust thing that needs to be there. We need to be able to trust in each other that this is a process that is supportive and is functional and can do what it's intended to do. So once this test phase is over, we, the methodology team, essentially write a report for senior managers, making some recommendations about what's the next step. And again, like we have done with this phase, you know, we will keep people informed in terms of what our next steps will be, because, like I say, we have nothing certain until we know what this actually shows us. It may be that there's more work that needs to be done to support the sector to be ready for self-evaluation. It may be that, well, actually it's all going great and we can kind of move on and trial self-evaluation in different ways to see what's most supportive to people. But we will keep engaging with yourselves. Somebody's struggling for the core assurances self-evaluation tool. I think Anthony's trying to help there. They are all on the website, so they should all be there under publications and statistics and professionals. So there's 2 links in. I'm sure Anthony can put a link in if you let him know which tool you're actually looking for. We're struggling with getting feedback from the clients for the service provider. Is it something we should be concerned? So feedback's always been an issue. And I think even as an inspector, I would always say when people were saying they were struggling with participation, you need to show that you tried. So you need to be able to evidence that you tried to get people's views and you tried to engage with people, and that those efforts were appropriate to whoever your audience is. So if it was maybe people with learning disabilities, you know, did you make your information accessible? You know, if it was people who, you know, maybe are in crisis, did you give lots of different ways of getting information? So as long as you're doing that and you can evidence, you know, we've tried, but actually people aren't interested in engaging with us, then that's fine, because you've made the effort. The whole point is, you know, you're offering an opportunity for people to be involved. If they don't wish to take it, then that's okay, as long as we can see that you've offered that opportunity. Do you still attend questions after this webinar? I think that's maybe, do we still answer questions? Yes, so you can email the methodology team and we will do our best to answer you as quickly as we can. That's no problem. Okay, so that's something that's not relevant to this about registering. You'll need to look on our website to register for information on registering. So an agency, candidate training's up to date, it's busy. yeah, we recognise obviously that everybody is busy and everybody struggles to do things like training and get those up to date. Of course, we're going to raise that as an issue. So yeah, so people need to be appropriately trained, and unfortunately that needs to be in place. So we would always raise that as an issue when you're being inspected. So please be aware as well that Anthony has put in a feedback form there. Please do complete it, otherwise we don't know whether this is what you want to hear, whether this is useful to you. So please do, it's very short. Can we invite a care inspector to face-to-face talk about the service without being graded? To be fair, the inspectors are incredibly busy, so may not have time to do that. And it depends what it is you're wanting to have a conversation about. You can email us more information if you want to. So Anthony's put in our email in there as well. And he's just put in the links for the toolkit. Okay, so I think that is all the questions from the chat. This is coming. Is there anybody that wants to ask anything? We've had no hands going up, so we take that as nobody wishes to speak. Okay. Well, like I say, Anthony has put a link to the methodology inbox within the chat. So if people do have something, please do let us know. And like I say, please do fill in the feedback form. But thank you very much for coming today and for, you know, giving us your time. I know time's very precious to people, but we do want to be as supportive as we can, so we need that feedback. And thank you for your engagement as well. See you all doing really well already. Like I say, it's just putting some structure around that self-evaluation. Okay, great. Thank you very much. And we'll just leave up the next slide, Anthony, and that has our email address on as well, I believe. Thanks, everyone.